But then we could look at, say, the Mediterranean lifestyle and diet, which is, the top tier of what people sort of strive after, and like the blue zones, and there's a connection with people, and then the raw ingredients and sunlight, and then they still will drink wine, but somehow that's okay. And there's lots of different things. They'll live till like ripe old age and have huge enjoyment and less stress and so on. What factors do you actually think are, firstly, it's in a beautiful setting on a terrace in Italy, and therefore we think it's brilliant? Um, Rather, like what can we actually take from that in terms of why, because they do live longer generally. Like, there is some merit and some fact behind it. What are your takeaways from that observation?
Yeah, I mean, I think it really speaks to that it's not just what you eat, but how you eat. That's also important. And like social connection is like a huge factor in terms of like loneliness and longevity, because actually our relationships are important and they really impact our mental health, but also physical health. Like the impact of loneliness on people's physical health in terms of like in older age, especially as people are more isolated. Like there's a lot of evidence around that nowadays. So I think it's also about how you eat, and also how you live your life, like being more active in your older age as well. Like maybe not even older, midlife. What we do in our earlier years impacts us later on down the line. So I think we can, the way that science, especially pop science, pop nutrition science, has been okay. Let's pick on this nutrient or this food, this superfood, and we don't eat that like that. We eat overall a kind of dietary pattern. We include different foods, different food groups, and we eat with people. You prepare and you enjoy food together. So it's not just about individual, like demonizing sugar or whatever the nutrient of the hour is. It's how do you eat overall? What's your dietary pattern like? And to in align with that, I'd say Mediterranean style diet has got quite a lot of evidence behind it being quite supportive of our health overall, mental health, physical health, like anti-inflammatory, especially in women's health. We often use it as a kind of guide for managing endometriosis, infertility, even PCOS. It's got a place. So I think it's a lot about the fact that our health is impacted holistically. Like it's not just diet. It's, do you sleep well? Do you manage your stress? Do you speak to other people? Do you have good, strong relationships? Do you enjoy life? Or are you actually quite lonely and miserable and very stressed and not sleeping and working all hours of the day and actually just ordering, delivery for your breakfast, lunch, and dinner? So it's about our way of life, not just I'm going to take this supplement and manage my blood sugars or whatever using a CGM and this, that, and the other to get longevity. Like actually, it's about the bigger picture.
Hmm. Yeah, you even mentioned, who do we prepare the food with? Who are we sharing it with? And it is just that it's not necessarily just the eating and what the ingredients are and if it's high salt or low salt, but it is that process of, are you sitting down or are you actually just having it on the go? Are you watching the screen and not actually facing someone? And there's so many different aspects. And the more you look into like human psychology and how it all links together and the gut brain connection, it just absolutely blows my mind. The more you learn, the less you know
Oh,
about
100%.
it.